Associate Professor Fatima Latif, not here. Dr. Chia Shi Lu, please take both cards together.
Sir, the objective of the Health Insurance Task Force is to study ways of improving private health insurance in Singapore in order to achieve more efficient and sustainable outcomes for our healthcare system. And this is important as close to 2/3 of Singaporeans currently have an integrated health insurance plan. Now, in this report that was released in 2016, the HITF recommended, well, a few things. The first, the publication of medical fee benchmarks to help raise price transparency so that patients can make more informed choices. The fee guidelines are expected to be published sometime this year, and the intention is to rein in escalating healthcare costs and ensure that medical services and goods remain affordable and accessible to all Singaporeans. The second recommendation was that HITF noted in its report that there were private insurance features and riders that, quote, provide policyholders with 100% coverage without any co-payment, unquote. And they expressed their concern that the absence of co-payment may encourage both overconsumption and over-servicing in regard to medical care. And I note from the report in today's papers that the six IP insurance have actually appealed to MOH to make co-payments compulsory. Finally, the HITF also made other recommendations to manage IP claims costs, such as the use of a panel of preferred providers and pre-approval of claims. And I just want to ask about the status of MOH's review on the Health Insurance Task Force report and recommendations. Next cut, Medisave. Over the years, MOH has liberalized the use of Medisave for outpatient medical costs, and I would like to ask if MOH would consider further enhances to the Chronic Disease Management Program, CDMP, and also the Flexi Medisave scheme, which allows the elderly to utilize more of their Medisave for outpatient medical expenses, and will the Ministry consider raising the Flexi Medisave sum? Would MOH consider liberalizing the use of Medisave for the cost of other allied services such as physiotherapy, or perhaps the use of consumables for chronic conditions like heart disease and diabetes? And as I often call for during the COS debate, I would like to ask the Ministry to include more chronic conditions under the Chronic Disease Management Program. I've always felt that this is an excellent program and feel that it should be expanded wherever possible, and including more conditions beyond the 19 already included will reduce the cash outlay required and encourage patients to be more compliant with treatment. I would also like to renew my call for the CDMP withdrawal limit to be calibrated to the number of chronic conditions that a patient has. So thus, a patient suffering from 3 chronic illnesses should be perhaps allowed to withdraw a little bit more than a patient who only has 1 chronic illness. Thank you.